Hi guys, welcome to the channel. I have a lot of updates for you today concerning the treatment of COVID-19. And as you know, there are some news going on right now, which is really hot concerning the hydroxychloroquine and zinc with a combination of potential azithromycin known as Z-Pak. And of course, this week, the American media has done a finest job at sensationalizing everything they can get their hands onto. So I'm here to debunk some of the myth and some of the facts concerning this modality of treatment. So hydroxychloroquine or chloroquine, they are basically cousins, in conjunction with zinc has been used in South Korea quite some time. That has been one of their main treatment for COVID-19 disease. And according to the South Korean scientists, it has been working pretty well there. In Japan, they are studying the high-dose antiretroviral medications against HIV, using that for COVID-19. And in China, they're doing a little bit of everything. Now, in France, they have been using hydroxychloroquine and azithromycin. Now, of course, there has been a new article that has been very widely spread online concerning the combination of hydroxychloroquine and azithromycin. And this treatment has been popularized by the French researcher by the name of Dr. Didier Raoult, who is the director at Myrisdane Infection, which is basically the equivalent of NIH in the United States. And he is the equivalent of Dr. Anthony Fauci of NIH. And basically, he released an article and a study of 26 patients. So it's quite a small sample. It's not like a massive study. 26 patients, and it is a non-randomized, non-label study, means that it's not double-blinded. They know exactly who to give the medication to, and they know who exactly is getting it, and the patients know that they get it. So, and they follow this patient over the period of 6 to 7 days, and they found that the group that received a combination of hydroxychloroquine plus or minus azithromycin has a substantial lower viral load in the oropharynx compared to the group that did not receive such treatment. So he theorized that the hydroxychloroquine has a significant antiviral effect against COVID-19. Now, I must caution you that as much as I want this to be true, as much as we want this to be the standard of care, during the time of worldwide pandemics and public fears, we are all scared, and we're all looking for hope, and we're all looking for something that would work and that would treat this and make it go away so we can resume our life and our freedom. I get that, but it is important that we follow the principle of evidence-based medicine. In order for me to prescribe a treatment, I have to be sure that what I'm about to do to patients actually will help them and not harm them. So we have to be patient. This thing is still pretty new in terms of treatment. The hydroxychloroquine and a combination of zinc has been used in South Korea for literally 2 months. And the combination of hydroxychloroquine and azithromycin has been used in France for literally a month and a half. So they are quite new, and we need more data before we can definitively say this will be the new guideline to treat COVID-19 infection. What is hydroxychloroquine? Well, it is not a new medication at all. In fact, it has been approved in the United States since 1955. Was approved for the usages of anti-malarial medication for soldiers in the Korean War. And after that, in the 60s, they have noticed that this medication worked quite well for people with autoimmune diseases. So it is approved by the FDA in the usage of rheumatoid arthritis, in the usages of lupus, and it even treats porphyria, which is an autoimmune skin condition. It is widely used. Of course, it's almost never prescribed by primary care physician like myself, and I'm not aware of any of my colleagues are prescribing this on a daily basis. But if you are a practicing rheumatologist, you would prescribe this medication on a daily basis. So we know what this medication can do, and we know the side effects very well. Now, despite what the media is telling you, that this medication is very old, it's widely used, it barely has any side effects, and is very safe, it is far from that. And they make it sound like this medication is the greatest thing since sliced bread. It couldn't be farther from the truth. This medication has quite significant side effects, and mild, ranging from nausea, vomiting, diarrhea, abdominal upset to dizziness and vertigo. If it's severe, it actually can cause retinal and corneal damages, and it can also cause liver damages, and it can drop the white cell count. It can even cause damages to the heart by prolonging what we call the QT interval. Now, for those of you who don't know what a QT interval is, it's basically a measurement on the EKG on the electrical system of the heart. So if it prolongs the QT, it can predispose you to fatal cardiac arrhythmia. And that is because of sudden cardiac death. And that is how it can kill somebody if you take hydroxychloroquine with no medical supervision. So we are far from giving people this medication as a prophylactic treatment against COVID-19, and we are far from confirming whether or not it truly works in COVID-19. But it is encouraging. It is encouraging. And I will explain to you in a minute what are the mechanism of actions of hydroxychloroquine and zinc. Quite busy slide, but I promise you it's gonna make sense in 1 minute. So what we have here is basically a cartoon representing a cell, a lung cell, okay? The so-called pneumocytes. Now, these pneumocytes, as we know, express a receptor on the surface of it called the ACE2 receptor, or angiotensin converting enzyme 2 receptor. Now, we know that the SARS-CoV-2 virus has different spikes, protein spikes on the surface, the S protein, the M protein, and we know that these spikes are basically a key to the lock. And as I explained in my previous video, if you put this key into the lock, which represented by the receptor ACE2, you will be able to unlock the door and enter into the house. And there we go. Once the virus is able to enter the cell, it's going to open itself up. This method is called actually endocytosis, and it would dump its genetic material into our cells. And very quickly, it would make a protein. And that protein is called replicase. Now, replicase is basically a photocopy machine of the cell. And the virus then would use this photocopy machine, replicase, and it would duplicate and photocopy its own genetic material. Look at how smart this thing is. What it does next is even scarier. It actually uses those messengers that it produced inside our cell and then basically force our genetic apparatus, the so-called Golgi apparatus, to basically make its proteins and make its outer membrane. So it makes the genetic material on this side and makes its outer membrane on this side and reassemble them into a new virus. And it's not just one virus, it's multiple copies of this virus. So when you have a virus entering the cells, using the genetic material and using our apparatus to multiply itself, and then it would exit our cell, the so-called exocytosis, and it will exit the cell in a massive amount of copies, sometimes in the hundreds. And therefore, our own pneumocytes or lung cells die and sheds off. And this is a very dangerous phenomenon because it directly kills our cells. Now, if you look at this different picture I have up here, it is a real-life picture, the so-called electron micrograph. And what this picture shows you is the coronavirus is able to enter the cells. And as you can see here, it basically entered the outer surface of the cells and started to make itself inside the pneumocytes. And inside, you see there's little balls with spikes on there. These are dozens of the viruses inside our cells. And from there, it makes its own genetic copies, as I just explained. Now, there is another picture that is quite interesting and quite fascinating, and that is you would observe after the virus makes its own genetic material, it would actually exit the outer membrane. And look at this. Look at this. It exits the outer membrane of the cells. It reassembles its outer layer, and then it would basically exit in a massive amount of hundreds of copies. So this is actually a picture showing particles of the new coronavirus being released from the infected cell. So very clever, very dangerous, wicked type of virus. And that is basically how the SARS-CoV-2 virus infects the cells. So the question is, how does hydroxychloroquine and zinc help to kill the SARS-CoV-2 virus? What are the mechanisms of actions? How does it work that a hydroxychloroquine and zinc can kill off this virus? Well, interestingly, hydroxychloroquine has a very unique property. And that unique property is it facilitates the entrance of zinc into the cell. And this has been proven over the years, over and over again, that hydroxychloroquine is able to do this. And in order for the zinc to enter the cell, it needs a window, it needs an entrance, it needs a door. And hydroxychloroquine basically provides that entrance. And that is what we call ion no 4. An ion no 4 means that it helps the ion to enter the cells. Now, zinc has a pH of 6.0. And it is interesting that once zinc is able to enter into the cells, it blocks the enzyme, the photocopy enzyme that replicate or photocopy the viral genome. So zinc has a direct inhibition effect of this replicase enzyme. Now, think about it. If you are able to stop the replicase, stop this enzyme in its tract from photocopying the viral genetics material, you effectively halt this virus from reproducing itself intracellularly inside a cell. So this has been a very interesting theory, and if more studies need to be done, if we can actually prove beyond a shadow of a doubt that the combination of hydroxychloroquine and zinc can do that and can stop the COVID-19 virus in its tract, I will be the happiest guy in the world, because we effectively find a treatment on how to deal with the SARS-CoV-2 virus. But again, most of the evidence are anecdotal. We have a very small study from France. We need more to be done. And I think in the coming weeks, we're going to know more about this. And as the information become available, I will certainly update you. And thank you very much for watching, and see you in the next video.